Welcome, colleagues, practitioners, and student clinicians, to this comprehensive Individual Remedy Masterclass. Today, we are staging up a deep dive exploration into one of the most clinically significant yet frequently misunderstood remedies within the traditional flower essence lexicon, Agrimony, the Agrimonia eupatoria, often summarized in introductory texts simply as the remedy for the mask of cheerfulness. Our clinical experience reveals that agrimony sits at the dark crossroads of emotional suppression, unvoiced domestic torment, and deep seated addictive escapes. In this lecture, we will look past the superficial outer smile to examine the precise energetic architecture, somatic markers, clinical case files, and differential diagnostic criteria necessary to master this remedy in your clinical practice. We will unravel why this specific remedy acts as an emotional catalyst, gently dismantling the artificial walls patients built to survive their environments and guiding them toward authentic inner peace and unshakable soul integrity. To understand agrimony at a structural level, we must first look at its position within the broader system. Dr. Edward Bach organized his 38 remedies into 7 distinct emotional groups. Agrimony is a foundational member of Group 5, Oversensitivity to Influences and Ideas. When we look at the energetic architecture of Group 5 remedies, which includes agrimony, centauri, walnut, and holy, the unifying thread is a highly porous, vulnerable ego boundary. These individuals do not possess an energetic filter capable of naturally deflecting environmental or interpersonal friction. They absorb the psychic and emotional climate of their surroundings like a sponge. However, while a Centauri type responds to this vulnerability by completely submitting their will to others, the Agrimony individual takes a vastly different path. They internalize the conflict entirely, building an artificial psychic wall of humor and lightheartedness to ensure the external world remains placid, quiet, and seemingly free of friction. Let us dissect this vulnerability further. When an agrimony soul is exposed to outside pressures, arguments, or negative environmental currents, they experience immediate, intense internal distress. They lack the aggressive boundaries of chestnut or vine archetypes. Instead, they operate as an emotional mirror, desperately reflecting back whatever positivity they think the environment requires to neutralize conflict. This creates a split within the psyche. The true self is experiencing acute pain, anxiety, or grief, while the false self or persona steps forward to dance, joke, and entertain. They become trapped in a self reinforcing cycle. The more intense the hidden internal suffering becomes, the more frantic and louder the outer mask must perform to keep that suffering at bay. As a clinician, you must understand that this vulnerability means the patient is constantly exhausting their vital reserves simply to maintain a social equilibrium. To anchor our study, we must return to the source text. In his definitive 1936 work, The 12 Healers and Other Remedies, Dr. Edward Bach penned a deceptively simple definition that contains the entire clinical spectrum of agrimony. He described them as the jovial, cheerful, humorous people who love peace and are distressed by argument or quarrel, to avoid which they will agree to give up much. Notice his use of the phrase to avoid which they will agree to give up much. This is a critical diagnostic key. The agrimony individual will surrender their financial security, their legal rights, their bodily autonomy, and their deepest personal values just to make an argument stop. Batch continues, though generally they have troubles and are tormented and restless and worried in mind or in body, they hide their cares behind their humor and joking and are considered very good friends to know. They are beloved life of the party hiding a private hell. When an agrimony patient enters your consultation room, they will not present with open weeping or a ready list of complaints. Instead, they will walk in with a bright, often radiant smile and will tell you about their severe health crisis or crushing life updates as if they were sharing a light-hearted joke. This is the deflector archetype in full clinical expression. If you ask a direct question about their emotional life, their marriage, or their inner state, they will instantly employ a witty anecdote or self-deprecating banter to pivot the conversation away from the core wound. Furthermore, they display a profound solitude panic. They cannot tolerate quiet rooms, long drives without the radio blaring, or moments of stillness, because the moment the external noise drops, the voices of their suppressed anxieties comes rushing to the surface. They are chronically restless, always needing a project, a social outing, or a screen to stay distracted. In our practice, we must always study the botanical signature of the plant, for the morphology of the living flora perfectly mirrors the psychological dynamics of the human remedy state. Agrimonia eupatoria grows as an upright sunny spike adorned with bright yellow flowers that stretch confidently towards the light. To the casual observer walking past the hedgerow, it looks entirely cheerful, radiant, and unbothered. However, if you look closer at the stem, underneath those beautiful yellow petals, the plant develops hidden, hard seed pods covered in hooked burs. If you brush past the plant, the Sticky hooks aggressively catch onto your clothing or animal fur, refusing to let go. This is the exact botanical signature of the remedy. On top, an unbothered sunny presentation. Underneath, a collection of sticky, nagging, hooked worries that cling to the lining of the subconscious mind, causing constant hidden irritation and unrest. Because the Agrimony patient refuses to give conscious voice to their suffering, the emotional tension is forced to find expression through the physical body. The laws of physiology dictate that what is suppressed in the mind must be crystallized in the stomach. As a clinical practitioner, we must look past the patient's smiling face and train our eyes to detect the subtle, involuntary somatic markers of hidden agony. The body never lies, even when the mouth is laughing. In this next section, we will explore exactly where and how this unvoiced emotional friction manifests across the physical systems, focusing on the muscular, respiratory, and enteric networks, where the agrimony state leaves its unmistakable pathological imprints. Let us examine the three primary somatic markers of the Agrimony state. The first is nocturnal bruxism, intense subconscious teeth grinding and jaw clenching that occurs during sleep cycle. During the day, the patient forces their jaw into a pleasant smile. At night, when the conscious guard drops, the massive backlog of unvoiced anger and frustration discharges through the masseter muscles. Second is the respiratory catch. These patients present with extremely shallow upper chest breathing. If you observe them closely, they often look as though they are holding their breath, keeping a rigid, tight band around their ribs to physically compress and, and hold down their emotions. Third are enteric knots. The solar plexus and enteric nervous system serves as the literal stomach for emotional processing. Because agrimony individuals refuse to digest their interpersonal conflicts, they suffer from the nervous stomach, functional dyspepsia, and severe irritable bowel syndrome driven by persistent background anxiety. We come now to one of the most critical clinical applications of agrimony, its status as a foundational remedy for substance abuse and behavioral addictions. It is vital to understand the abuse that the agrimony individual does not turn to drugs, alcohol, or compulsive behaviors in search of a thrill, a high, or hedonistic pleasure. Their addiction is driven entirely by a desperate quest for anesthesia and oblivion. When the social gathering ends and they are forced to return home to a quiet room, the internal mental torture becomes unbearable. Alcohol, sedatives, marijuana, or compulsive comfort eating act as a chemical shield, a blunt instrument used to knock out the conscious mind and silence the screaming anxieties within. They drink or use to keep themselves feeling pleasant, or at the very least to numb the pain so they can sleep without facing their inner shadow. In any recovery protocol, if you do not address this root need for anesthesia, the patient will consistently relapse. To fully appreciate how these theoretical principles manifest in real world clinical practice, let us move away from textbook definitions and examine the actual clinical case histories. Looking at real cases allows us to see the precise tracking of the remedy's action over time, how it interacts with the patient's defense mechanism, how it triggers the release of long held emotional blockages, and how it safely transforms deep seated patterns of dependency into authentic self expression. We will review two distinct clinical profiles, a corporate executive using alcohol to mask domestic trauma, and an overworked creative professional using hyperactivity to outrun an internal shadow of bitterness and envy. Our first case concerns a 40-year-old male corporate executive who presented clinically for severe insomnia and escalating nighttime alcohol consumption. Publicly, this man was a tour de force, highly charismatic, endlessly witty, exceptionally successful, and universally adored by his colleagues. He was the quintessential life of the party who spent his days smiling and laughing. However, his private life was an absolute minefield of unvoiced domestic disputes and emotional neglect. Every night, the moment he stepped into his private study, he would consume half a bottle of spirits. He told me, "I don't drink to feel good, doctor. I drink to turn off the radio in my head so I can close my eyes." He was prescribed Agrimony in a treatment bottle. By week 3, a massive shift occurred. He experienced sudden spontaneous impulse to confront his material distress openly, engaging in difficult but necessary conversations. By mouth, by month 2, his physical craving for nighttime alcohol completely vanished alongside his chronic insomnia. Our second case involves a prominent landscape architect who came to the clinic presenting with severe physical exhaustion, chronic teeth grinding, and recurring panic attacks that occurred exclusively at 0 hour, the exact moment he stopped working at the end of the day. This man routinely logged 18 hour workdays, hiding a deeply bitter, envious inner landscape behind an ultra polite, meticulously curated social exterior. He was constantly running, using extreme workaholism to outrun his internal shadow of professional jealousy, and personal unfulfillment. He buried his shadow beneath a permanent, strained smile. I initiated a protocol featuring Agrimony. The therapeutic progression was profound. The remedy gave him the quiet, unshakable strength to stop running and finally look at his shadow without shame or self judgment. Over the course of 12 weeks, he successfully transitioned from a state of fake, exhausting positivity to authentic self acceptance, scaling back his work hours and developing genuine boundaries. To assist you in tracking your patient's progress across extended treatment plans, I have constructed this clinical progression matrix. It maps the evolution of the patient across three critical vectors: social persona, conflict style, and their reaction to solitude. At baseline, the negative agrimony state is characterized by a fragile, defensive humor. They use jokes as a shield. Post remedy, these mutates into a genuine, unforced optimism that does not require a mask. In terms of conflict style, the baseline state is one of toxic suppression, where they act as an emotional martyr to keep the peace. Post remedy, they develop the capacity for honest, calm boundary setting. Finally, while their baseline reaction to solitude is one of restless panic and an urgent need for external stimulation, the post remedy reality is marked by a deep, beautiful comfort in quietude and self reflection. As a clinical homeopaths and flower remedy practitioners, our ultimate diagnostic accuracy depends entirely on our ability to perform rigorous differential diagnosis. It is easy to look at a patient who drinks heavily or grinds their teeth and simply guess at a remedy. But true clinical mastery requires us to separate superficial behavior similarities from the deep underlying psychological drives. In this next segment, we will compare Agrimony against its most common homeopathic and flower essence look-alikes, specifically sulfuric acid, Nux vomica, arsenic album, and Natrum muriaticum. We will dissect exactly how to cross-reference these remedies, ensuring that your prescriptions target the correct energetic layer of patient's pathology. Let us begin with a critical clinical differentiation. The patchfluorescence agrimony versus the homeopathic preparation sulfuric acid. Both of these remedies are top tier indicators for severe chronic alcoholism and patients who present with intense internal restlessness. But their operational layers are completely distinct. Agrimony operates purely on the emotional layer. The drivers behind their substance use is entirely psychological. The agony of maintaining a social smile while tearing themselves apart inside. Homeopathic sulfuric acid, however, operates primarily on the metabolic and cellular layer. The sulfuric acid patient exhibits an intense physical trembling, a frantic internal hurry driven by cellular depletion, and a deep biochemical craving for spirits to fuel a collapsed metabolic engine. Agrimony drinks to soften the world. Sulfuric acid drinks because their cells are starving for the rapid calorie input of alcohol. Next, let us differentiate agrimony from our great polycrest remedy Nux vomica. Both archetypes are classic type A workaholics who frequently abuse stimulants, alcohol, and rich foods to cope with heavy stress, but their underlying psychological paradigms are completely opposed. The agrimony individual is fundamentally a seeker of social harmony. They internalize all of their irritability, anger, and bitterness, burying it deep behind a pleasant, humorous facade because they cannot tolerate interpersonal friction. The Naxwamika individual, conversely, is a competitive warrior. They do not hide their irritability, they express it overtly, acting critically, aggressively, and demandingly they, with those around them. Agrimony uses alcohol to stay pleasant and numb their pain. Nux vomica uses alcohol and stimulants as high octane fuel to work harder, crash faster, and dominate their environment. To further solidify your diagnostic framework, let us look at this comparative anxiety matrix, which examines how different remedies handle their core anxiety triggers and definitive strategies. Look at Arsenic Album. Their anxiety is focused tightly on health, germs, disease, and financial poverty. Their defense mechanism is meticulous order, micromanagement, and a constant demand for mental reassurance. Now, look at Nitromuriaticum. Their anxiety stems from deep unvoiced grief, past rejection, and emotional trauma. Their defense strategy is to build an impenetrable emotional wall, completely isolating themselves from society to prevent future hurt. Finally, look at agrimony. Their anxiety is triggered exclusively by interpersonal friction and conflict. Their defense strategy is to leap into the social spotlight using jokes, laughter, and light-hearted anecdotes to keep everyone happy and at a distance. In this next segment, we introduce an interactive clinical assessment tool, the three-question mask test. This self-assessment is designed to bypass the conscious mind's defense and help students or patients instantly recognize the structural presence of an agrimony facade in their own lives. Let us examine these questions and see how they function as diagnostic mirrors. Here are the three diagnostic questions that form the core of our mask test. Question number one. Do you routinely tell people everything is wonderful? I am perfectly fine. even when you are enduring a massive emotional crisis, a divorce, or a severe physical illness. This identifies the core deflector mechanism. Question number two. Do you compulsively reach for your phone, turn on the television, or open a bottle of wine the exact second you find yourself completely alone in a silent room? This exposes the presence of solitude panic. And question number three. Will you actively surrender your legal rights, your financial security, or your personal values in an argument just because you cannot tolerate the discomfort of conflict? This confirms pathological peace seeking. If they answer yes or two or more of these, your patients, the agrimony mask is firmly in place. Now that we have established the energetic architecture, the somatic markers, and the differential diagnosis of agrimony, we must turn our attention to practical therapeutics. Knowing what a remedy does is useless unless you know precisely how to implement it within a clinical protocol. In this section, we will cover the advanced clinical implementation of agrimony. We will look at targeted formulation trios for complex psychological profiles, explore the mechanics of the emotional detox crisis, outline the exact dosage strategies for acute and chronic conditions, and demonstrate how to properly manufacture a custom treatment bottle using the traditional sun method. In complex clinical presentations, agrimony rarely acts entirely alone. It is frequently combined into formulation trios to address specific modern coping strategies. Let us look at three highly effective combinations. First is the binge eater trio, agrimony combined with crabapple and cherry plum. This targets individuals who hide their emotional pain behind a smile during the day but compulsively binge eat at night, experiencing profound self disgust and a terrifying loss of control. Second is the stress addict trio. Agrimony combined with elm and oak. This is for the high functioning professional who masks severe burnout, pushing through extreme physical exhaustion while refusing to acknowledge their limitations. And third is the digital escapist trio. Agrimony paired with clematis and walnut. This targets the modern patient who uses constant social media scrolling, immersive gaming, and online daydreaming to escape intense family friction and break old habit links. As a practitioner, you must proactively manage what we call the emotional detox crisis. When a patient begins a course of agrimony, the remedy immediately begins to melt away the rigid artificial armor they have worn for decades. Because this armor was holding down a massive black backlog of unexpressed grief, anger, and anxiety. That material must now safely drain through the nervous system. Typically, between days 3 and 7 of the protocol, the patient may experience a temporary intensification of symptoms, unexpected waves of sadness, spontaneous crying spells without an obvious trigger, or incredibly vivid, high intensity dreams. You must educate your patient before they start the remedy that this is not a negative side effect or an allergic reaction. It is the ultimate proof of therapeutic success. The emotional abscess is finally draining, clearing the path for true, permanent tissue and psychic healing. Our standard clinical dosage protocol for chronic constitutional cases follows the traditional guideline of 4 drops taken 4 times daily, delivered directly under the tongue or dissolved in a small glass of pure spring water. However, I want to share a critical clinical adjustment. Always ensure the final dose of the day is administered right before bedtime. This places the vibrational frequency of the remedy directly into the subconscious mind before sleep, dramatically reducing nocturnal jaw clenching and promoting restful sleep without the need for chemical downers. In acute situations, such as a sudden intense craving for an addictive substance or a mounting wave of social panic, the protocol shifts. Administer 1 dose every 15 minutes directly on the tongue until the acute emotional storm passes, instructing the patient to hold the liquid under their tongue for 5 seconds to maximize the mucosal absorption. As we enter the final movement of our masterclass, let us elevate our gaze from the mechanics of physical symptoms and dosage charts to look at the ultimate destination of the Agrimony journey, spiritual realization. We must always remember that flower essences are not merely natural tools for symptom suppression, they are highly advanced evolutionary catalysts. Their true purpose is to help the human ego dissolve its negative distortions, integrate its shadow, and step into alignment with its higher soul blueprint. In this section, we will explore the deep philosophy of Dr. Edward Bach, tracking how the Agrimony archetype evolves from an exhausting, hollow social persona into a state of unshakable inner peace, absolute structural integrity, and authentic grace. To truly comprehend the spiritual dimensions of this work, we must meditate on Dr. Bach's foundational philosophy outlined in his 1931 masterpiece, Heal Thyself. Bach wrote, health is our heritage, our right. It's the complete and full union between soul, mind, and body. And this is no difficult, far off ideal to be attained, but one so easy that many of us have overlooked it. When we apply this philosophy directly to the agrimony state, we realize that the disease arises specifically when there is a profound split between the soul's internal truth and the mind's fabricated social persona. The agrimony individual believes they must lie to the world to be loved and safe. True health returns only when the mind surrenders its fabricated facets, allowing the body to align perfectly with the raw, unfiltered truth of soul. What happens when the Agrimony soul finally integrates this remedy? They cultivate three magnificent spiritual virtues. First is radical self expectance. They completely shift their focus away from chasing external social approval or playing a character. Instead, they anchor themselves in a deep internal alignment, embracing their flaws, grief, and shadows without shame. Second is true peace of mind. They realize that interpersonal disagreements and conflicts are not dangerous threats to survival, but healthy, necessary mechanisms for psychological growth and boundary definition. They no longer run from a fight. Third is absolute integrity. They dismantle the suffocating mask of cheerfulness completely, stepping into a state of authentic grace where they are genuinely proud of the unique soul standing underneath. To ensure you can seamlessly execute these principles starting tomorrow morning in your clinic, I have summarized our methodology into this practical practitioner's roadmap. Step 1 is intake. Train yourself to look entirely past the patient's radiant smile. When they tell you about a crisis with a laugh, plant your flag. Cross-reference their words immediately with a rigorous screening for somatic markers. Check their masseter muscles for jaw tension. Watch their upper chest for a respiratory catch and inquire about functional digestive knots. Step 2 is analysis. Map out their primary emotional drivers. Perform a meticulous differential diagnosis against constitutional homeopathy to determine if they need the emotional layer of agrimony or the metabolic support of remedy like sulfuric acid. This roadmap ensures your clinical approach remains standardized, safe, and highly effective. We have covered an immense amount of clinical and philosophical territory today, moving from the porous ego boundaries of the oversensitivity group to the exact physical imprints of unvoiced suffering in the human body. I want you, I want to thank each of you for your deep focus and dedication to mastering this profound individual remedy. I now open the floor to your questions, case presentations, and clinical insights. For those watching this masterclass online or on our digital channels, please join our global discussion in the comment sections below. Do you recognize the Agrimony mask in your current caseload or perhaps in your own life? How have you successfully navigated the emotional detox crisis with your patients? Let us share our collective data to elevate the standard of holistic medicine worldwide. Before we conclude our session today, and disperse back to our respective clinical practices, it's our administrative duty to explicitly state our standard legal and clinical disclaimers. The advanced information, formulations, case analysis, and protocols detailed throughout this masterclass are designed exclusively for professional educational purposes and to expand clinical research frameworks. This content does not substitute for formal licensed medical advice, psychiatric diagnosis, or structured addiction recovery programs. As professional holistic practitioners, you must always exercise independent clinical judgment, operating within your local legal scope of practice and consulting with multidisciplinary healthcare teams before altering a patient's formal medical or psychological treatment regimens. As we close our books today, let us ground ourselves in a final reflection on the profound historical lineage we inherit. When Dr. Edward Bach abandoned his lucrative London Harley Street practice as a conventional bacteriologist and homeopath to discover these simple remedies in the fields of Wales, he did so under a singular revolutionary conviction that true healing must be simple, accessible, and focused entirely on the soul of the individual. By taking the knowledge mastered in this class and applying it with absolute precision, you are doing more than prescribing a remedy. You are honoring a century old tradition of pure, gentle, and transformative medicine. Go forth with confidence, look past the masks of your patients with deep compassion, and guide them back to their heritage of authentic health and inner peace. Thank you for your time, your presence, and your dedication to the healing arts. Thank you.